Welcome to this short revision video.
The objectives of this are to give you an overview of male and female catheterisation, to be aware of what you can touch when and what you can't during catheterisation, and to have an understanding of why people fail this station. When the station comes to Nosky, there are numerous reasons why people fail this station. It does have quite a high failure rate. The most common reason for people failing is a failure to maintain sterility. Other issues that people have is they're not changing the gloves between cleaning the site and inserting the catheter, touching the catheter itself. One common theme that turned up was students picking up a catheter pack from another site, and this caused confusion when they were actually performing the procedure because the equipment may be slightly different. There may be also issues of timing here. Whilst you shouldn't fail for not completing the procedure, you at least need to be a good way through it for the examiner to be able to assess you properly. It's quite important to note that what we've aimed to produce here is a generic video for revision. Equipment, procedure, opinion and policy will vary from place to place, and in practice, clinical practice, you should always follow the policy within your workplace. So start off by washing your hands and introducing yourself to the patient using your full name and title. Confirm you have the correct patient by checking their name and date of birth, and explain what you'd like to do. Tell them that someone will assist you throughout this procedure and gain their verbal consent. Ensure the patient's privacy at all times, and ask the patient to undress completely from the waist downwards and to lay on the bed and cover themselves. If you're asked to do this on an unconscious patient, then it's important to check that the consent form has been signed before the procedure begins. So begin the procedure by putting on an apron and washing your hands. Then take a wipe and clean the surface in which you're going to create your sterile field. Wash your hands again since you've been cleaning. And then, having checked the expiry date on the catheter pack, open it and place the inner packet on the newly cleaned area. Since you've been touching out of packaging, wash your hands thoroughly again because you're about to touch what is to become the sterile field. Make sure you only touch the underside and not the top of the sterile field itself. Once you've created your sterile field, nothing that isn't sterile should ever touch this sterile field. If it does, you will have to start again. You can then use the underside of the sterile field to move some of the equipment around a little bit to gain access to your tray. Take your catheter, check the expiry date on it and that you've got the right size and type of catheter, and carefully open it onto your sterile field, making sure that the packaging doesn't touch the sterile field at any point. Save the lot number from your catheter packaging, as this will have to go into the notes after the procedure's been performed. Check the expiry date on your instiller gel, and again carefully open it into the sterile field. Check the expiry date on the sterile gloves and put those into the sterile field, taking care not to touch them. It should be noted that 2 pairs of sterile gloves are usually required to perform this procedure, although this will vary from site to site. Some places advocate cleaning the top of the Normasol with a chlorhexidine wipe, and then pour the Normasol into your sterile galley pot. Check the expiry date on the catheter drainage bag and place that at the end of the bed, ready for use at the end of the procedure. At this point, if your patient or your assistant is going to be unable to help you uncover them, you need to uncover the patient. You won't be able to do this once you've got your sterile gloves on. Because you've been touching all the packaging and the bedding, wash your hands again thoroughly. Ideally this would be a soap and water wash at a sink. Don your first pair of sterile gloves. Now you've got your sterile gloves on, do not touch anything that isn't sterile. Take your drape and ideally ask your assistant or the patient to uncover themselves at this point, if not previously done. And place it over your patient, as seen here, whether male or female. Take some gauze and create a sling, or hold the labia apart, and then take your cotton wool and clean around the area. Repeat this procedure using a new piece of cotton wool each time until the area is thoroughly clean. With the female patient, always make sure you're cleaning from top to bottom. With the male patient, clean from the meatus outwards in concentric circles. Once you've cleaned the patient, then insert the instiller gel into the urethra. You now need to change your gloves. When eventually you've put your second pair of sterile gloves on, take the receiver and place it on the end of the sterile drape between the patient's legs. This will be used to catch any urine that dribbles out of the catheters during insertion. Open the water that you're going to use to inflate the balloon on the catheter. Remove the top of the packaging of the catheter and then use a piece of gauze to either hold the penis or part the labia. Insert the catheter into the urethra, making sure at no point you touch the catheter itself, only the outer packaging. During an auscultation, you may be required to lubricate the tip of the catheter with a silicone oil before proceeding to insert it into the urethra. Once you're happy that the catheter has been fully inserted and you've seen urine draining, take the 10mm syringe that's got the water in it and inflate the balloon. Whilst inflating the balloon, check for resistance and ask the patient to report any pain just to make sure that you're not inflating the balloon in the urethra. Gently pull back on the catheter until you meet resistance, and then take the catheter drainage bag, remove the cover on it, and connect the two parts together. Replace the foreskin where necessary, and clean up any mess. Finally, tell the patient it's over and thank them. You should then document the residual volume and colour of the urine drained, the size of the catheter that you've inserted, the reason for the catheterisation, the volume of water in the balloon, sign and date it, and finally thank your supervisor and tell them that you've finished. Thank you very much for listening to me. We hope you found this video useful.